Before going into discussing any other tools, let's start discussing a recent but very important concept in healthcare, that is root cause analysis. In this video we'll briefly discuss what root cause analysis means and what a root cause is. First, let us ask ourselves, what is the importance of analyzing any specific problem down to its roots? And how accidents happen? Indeed, this is a topic in itself. However, we will try to briefly understand what the three basic models explaining how accidents happen are. Furthermore, we will discuss one of the tools that is used in root cause analysis, the 5 whys method. Then, we will specifically discuss its use in healthcare. Also, we'll refer to other tools that could be used for root cause analysis. As the case with most of other safety principles, root cause analysis has started outside healthcare industry. It has been developed in parallel to accidents investigation. Both professionals and business owners were interested in understanding how accidents or in general unwanted events do happen. That is why many theories have been developed over the years trying to understand why accidents do happen. This aimed to achieve things. First, to contain the events. Second, to correct them. And third, to prevent them from happening in the future. Of course, this was impossible without clear understanding of the mechanism of accidents. There are 3 main models for explaining how accidents happen. They are simple linear models, complex linear models, and complex nonlinear models. Indeed, details of these models are beyond the scope of this course. However, we will go briefly into a conclusion of each model because this will help us to understand further tools of root cause analysis. Let us start with the first model, the simple linear model. The simple linear model simply assumes that accidents are the culmination of a series of events or circumstances which interact sequentially with each other in a linear fashion. And thus, accidents are preventable by eliminating one of the causes in the linear sequence in the linear model. Secondly, complex linear models are based on the assumption that accidents are a result of a combination of unsafe acts and the latent hazardous conditions within the system, which form a linear path. Again, it assumes a linear relationship sequence of events. However, they also assume that there are different linear sequences inside the system that interact together. And this makes them different from the simple linear models. Lastly, the complex nonlinear models have moved forward recognizing that accidents models need to be nonlinear. And it is only through understanding these combinations and interactions that we can understand how to prevent these accidents from happening in the future. Complex, nonlinear models are very important in explaining many of the accidents or incidents that occur in healthcare system. They fit the healthcare system. While actually, healthcare system, especially nowadays, is a type of complex adaptive systems. The system is composed of different groups of factors interacting together. Very rarely you will discover that there is one reason or root cause of a problem or outcome. Mostly every outcome has different interacting variables behind it. This is just a brief about the 3 models for explaining how accidents do happen. We will need this understanding later to further clarify the mechanism of root cause analysis. Contrary to the relative long history of root cause analysis in other industries like aviation, space industry, and the chemical industry, root cause analysis in healthcare is a very recent concept. It's only about 20 years old. It started to show up in organizations like hospitals and medical centers. At the start, it aimed to approach the root causes of incidents in organizations trying to improve patient safety. Indeed, variable tools were tried by professionals, but till now there is no standard framework for root cause analysis in healthcare. Apart from being a common concept in healthcare, root cause analysis is an effective concept. To confirm this, there is a very recent study done by Delgado 2020. This study is composed of systemic reviews of different studies done on root cause analysis. In the study concluded that root cause analysis is a useful tool for the identification of the remote and immediate causes of safety incidents. However, it's not so effective in implementing effective measures to prevent their recurrence. This means that a root cause analysis itself as a methodology is a useful tool for the identification of either the remote or the immediate causes of safety incidents. However, if not effective, there must be some other reasons that we should take care of them. Now let's have a quick review of the factors affecting a useful root cause analysis. Delgado, 2020, has identified 3 main factors that affect the usefulness of root cause analysis in healthcare. These are: first, safety culture of the organization itself. Second, decision-making procedures. And third, management leadership styles. Root cause analysis in healthcare is just a tool to improve patient safety or to understand the root causes of problems that we face. It is not magic. Its effectiveness depends upon being appropriately implemented in the right situation. In other words, let's say that a team in a hospital has conducted a very effective root cause analysis for a certain incident inside the hospital. The team has reached a perfect recommendation to management. However, unless there is a conducive patient safety culture of the organization that supports implementing the action plan, unless there is an easy and clear decision-making procedure inside the organization, plus management that is supporting of patient safety itself, nothing of the action plan will be effective on the ground. Again, whether we are using root cause analysis or any other quality tools, these are just tools, and there must be management commitment to implement the action plans, in parallel to commitment to understand the real causes of the incident. Now, let us ask, what does a root cause mean? One of the best definitions of root cause is the one by Paradise and Bush, 1988. They define a root cause as the most basic cause that could be reasonably identified, and that management has control to fix. Now let us go through this definition in more details. A root cause is a basic cause. It is not a symptom. Reasonably identified means that it should be feasible. It is not imaginary. If we are talking about a root cause that may need years of follow-up or could exhaust most of our resources to solve it, is not a real root cause. Lastly, it should be controllable. In other words, the organization should have control over this cause. Climate, for example, could not be considered a main root cause analysis as it is beyond our control. Professionals over decades used different tools to delve into the root causes of unwanted events like defects, adverse events, accidents, and so on. Over the rest of this video, we will discuss one of the common tools used for root cause analysis, the 5 whys method. In the next video, we will into details and practice example of a more advanced tool, the fishbone diagram. Now, let us have a look on the 5 whys method. Simply, the 5 whys tool depends upon asking a successive number of whys, starting with a defined problem, aiming to reach down to a root cause of this problem. Actually, the number 5 here is arbitrary, and we may use less or greater than 5 whys to get to a satisfactory root cause for the problem under study. Let us take an example. As you can see, we have started here by defining a problem, a very specific problem. Emergency lights did not work upon electrical shutdown. This is our problem. It is specific, concise, and clear problem. We should note that the problem should be concise, clear, and specific. Otherwise you will be distracted during your analysis. Also try to avoid as possible as you can using combined problems. What a combined problem does mean. Combined problems refer to using combined statements or trying to refer to more than one problem in the same statement, because this mostly will lead to diversion of the analysis of the exercise itself, and mostly you will not reach to a root cause at the end. So, let's go back to our problem. Emergency lights did not work, an electrical shutdown. This is because emergency unit is broken down. Why? Because maintenance contract for the emergency unit is not renewed. Why? Because the maintenance department skipped contract renewal. Why did they skip it? Because management launched a cost reduction plan. Let us say that we would like to validate our sequence. We can just go back and instead of using why we will use therefore. Let us try it. We could start by management launching a cost reduction plan, therefore, the maintenance department skipped contract renewal. Therefore, the maintenance contract was not renewed. Therefore, the emergency unit was broken down. Therefore, the emergency lights did not work upon electrical shutdown. So, it's very simple, a nice way of reflecting about the real causes of the problem or the probable real causes of the problem, to be more specific. It's good in giving us some insights into the immediate causes about the problem itself and also about the remote causes. And this is one of the very good advantages about the 5 whys method. You can start with a problem at a level of emergency lights. However, when you go down with your analysis, you may reach up to the top management level as the root cause of the problem under study. Again, it's very important to start with a concise, clear, and specific problem. Otherwise, the whole exercise could end in nothing. The 5 whys method is a very common to use a root cause analysis in healthcare. It is supported by many organizations in healthcare and like the World Health Organization, the English National Health Service, the Institute for Healthcare Improvement, the Joint Commission, plus many other organizations all over the world. Now let us have a quick review of pros and cons of using 5 ways to educate pros, as we have said before. It's a very easy tool to use in healthcare. It assists us in reflecting upon the immediate and remote root causes of an incident on the other side. The main critique about 5 whys method is that it assumes a linear sequence of events leading to the incident, which is not commonly true, especially in healthcare, as the healthcare system, as we discussed before, is a very complicated system. So, the 5 whys method focuses on one main cause, which may be far from true. Actually, the 5 whys method is a powerful tool in stimulating reflection about both the immediate and the root causes of a problem. However, using it in healthcare as an independent tool should be done with great care. As healthcare is a complex adaptive system, it's a complicated one. Therefore, the 5 whys method is better to be used within context of a more detailed model of root cause analysis, like, for example, the fishbone diagram, which will be discussed in more detail in the next video. See you then.